Mkiwa hujambo, welcome to this GTN Nursing Services where I, Grace the nurse, talks about mother and child health care. Our lesson of today, we are going to see how to assess a child for developmental milestones. We are going to learn how to assess a child for the milestone development. So what are milestones? Milestones are the markers or the achievements that a child is supposed to acquire at a certain age during the maturation. Milestones are the achievements or the markers that a child is ought to have acquired during the process of maturation. For someone to assess the milestone of a child, it is very important to consider the gestational age. That is, at what age was your child born? We say a pregnancy reaches maturation at 40 weeks. So if a child is born at 32 weeks, it means that this child is 8 weeks behind his or her peers who are born at 40 weeks. So when assessing the milestone of a child, it is very important to consider the gestational age at birth. So what are these milestones that are assessed in a child as the child continues to grow or the child is maturing? The areas of assessment for a child's maturation are the gross motor, the fine motor, the language, the cognitive skills, and the socio-emotional and behavior. Those 5 things are the ones we call milestone, and how they develop during the child maturation is very, very important. Who is the person that is supposed to be assessing this child for these milestones? This is the caregiver and the healthcare provider. So when the mother is having a child at home, it is very important to assess the gross motor of a child, the fine motor of a child, the cognitive skill of a child, the language, and the socio-emotional and the behavior of a child.